Minimally invasive hip replacement surgery is actually defined as just a very small incision for your hip replacement. So an incision less than 10 centimeters, which is the entire definition. I think the important things about how we do hip surgeries is not just the length of the incision, but what muscles and tissues we damage when we're doing an operation. When I do surgery, I do surgery without cutting the major muscles that you then rely on when you're walking and running afterwards. This should ensure a better result, less chance of limping after a hip replacement, and return to a normal function. And the aim is to get something called the forgotten joint. So what I want is my patient to have had a hip replacement, and when I ask them which hip they've had replaced, they have to think about it for a second, because one hip feels like the other hip. It probably takes a bit over an hour to do a minimally invasive hip replacement. What it involves is probably slightly different instruments to allow us to access the hip, to mean that we can proceed without having to dissect more soft tissue. Hopefully it should result in a quicker recovery and less problems after the surgery. My patients go home at a variety of times after surgery. I've had people go home the same day, but that's by no means standard. I would say most people are at home by day 2 after hip replacement surgery, but some people may want to stay for 3 days. At that stage, they should be able to walk with 2 sticks and go up and down stairs, and self-care. By 6 weeks is when I next see them. I expect them to be walking without any aids and doing most things. I ask my patients to be careful with their hip for the first few months, because that's the most at risk time while everything is healing. And I expect people to return to normal activities by 3 months. I let people do most things. I probably warn them against some positions in yoga and those sort of things. The advantage is you have a smaller scar, you have less soft tissue dissection, and you should have a quicker recovery. I think if you try and do it and you haven't done many, I think it's quite hard to suddenly do everything through a smaller hole. I think there is a technical challenge there. I think once you've done a number of them, it's better for your surgeon, because he doesn't have to repair so much tissue that he's damaged.